Okay, so this is chapter 20. This is the chapter on blood vessels for college and high school anatomy physiology. And this is part 1. We're going to be talking about the different types of blood vessels and the anatomical differences of them, and also their physiology differences, what's their purpose. And those are all the learning targets associated with the blood vessels, the specifics of them. So make sure you're able to answer those. So the 3 types of blood vessels: arteries carry blood away from the heart, capillaries, the smallest blood vessels where gas exchange happens between blood and the body tissues, and veins transport blood from the capillaries back to the heart. When you look at a blood vessel, the cross-sectional view, the blood vessel has an opening in the middle. That opening, that space, is called a lumen. And then outside to that opening, so here's our lumen, we have the walls of the blood vessels, and they're composed of 3 layers. These layers are called tunics. There's a tunica intima, or the middle layer. The middle layer is the tunica media, and then the outside layer is the tunica externa. The innermost layer is made up of cells, epithelial cells called endothelium, simple squamose, so it allows for diffusion of materials. The muscle layer is the middle layer, and so this is smooth muscle that's located in this tunica media. When those muscle cells contract or tighten, it causes vasoconstriction, or narrowing that lumen. When they relax, it dilates that blood vessel, causing it to widen that lumen or space in the middle. The outer layer is the externa. Not really to know much about that, except it's made up of tissue that helps anchor it to the tissues around it. Here is a comparison between arteries, capillaries, and veins. We can see the lumen of them. You can right away see that the lumen of the veins is larger. Also, within the lumen of many veins, you have valves. Just like the valves in the heart, these valves help prevent backflow in the veins, because their job is to get blood back to the heart, so they have to fight against gravity to ensure blood flows in a one-way direction to get back to the heart. You can also look at the media layer right here between the artery and a vein, and you can see that the artery's tunica media is a lot thicker. And then we can also look at the capillary. Notice there's just the inner lining, just the tunica intima in the capillary walls. There's no muscle. So arteries and veins typically parallel each other. They lie next to each other, and they serve the same body region. Arteries, like I said, have a thicker tunica media or muscle and a narrower lumen, and they also have more elastic and collagen fibers, because the arteries has blood within them that's under high velocity, pushed with a lot of force through it. So they're just like an elastic hair tie. When they stretch, they have to be able to bounce back relatively quickly, spring back to their original shape. And that thicker muscle makes them more resilient and resistant to changes in blood pressure. Veins do have a thicker outer layer and a bigger lumen. You'll be able to see that in a cross-sectional view. Veins actually totally, collapse if they don't have blood in them. So they don't have a lot of elastic tissue. The capillaries, they only have an inner layer, like I said, and they're very thin walls for gas exchange. Here is a very nice picture that shows not only the general arteries and veins, the capillaries where they meet, but it also shows the 3 different types of arteries and the 3 different types of veins. So large arteries branch into smaller arteries that extend from the heart. As they get further away from the heart, the lumen decreases, the amount of elastic fibers decrease, but it increases in smooth muscle. So first, elastic arteries, called conducting arteries, are the closest to the heart. They connect the heart to other arteries. A lot of elastic fibers that allows to stretch and recoil because it's going to have blood vessels with the largest blood pressure within them. So these are blood arteries like your aorta, the pulmonary trunk, the common carotid that goes up to the head, and then your iliac arteries. So receiving blood from those arteries are your muscular arteries. They're medium in size, and they're very specific in their name. They have specific areas of the body that they give blood to. Like the brachial artery would be an example of a muscular artery. And the muscles in their layer allow for vasoconstriction and vasodilation that can help adjust blood pressure as needed. Receiving blood from those muscular arteries are your arterioles. These are your smallest diameter arteries. And it does have smooth muscle. Usually it's somewhat constricted to maintain what's called vasomotor tone, to keep the blood moving. So they help regulate systemic blood pressure, or that top number in a blood pressure reading, the maximum pressure in blood flow. Very important for that reason. This is the cross-sectional view of an artery right here. This is the elastic artery. You can see all the elastic tissue right here. Here's the muscular artery, more muscle, and then the arterial. Capillaries. They connect the arterioles to the venules, so small arteries to the small veins. The cool thing, they're so small. These are where the blood vessels can go through single file, the erythrocytes. And they just have the inner lining, very thin, to allow gas exchange, for fluid exchange. And there's actually 3 different types of capillaries. I guess the theme for chapter 20 is things in groups of 3. So there's continuous. Continuous meaning the cells in that inner lining are pretty close to each other. They form a continuous lining. They have tight junctions where they meet. It doesn't form a complete seal, but it's very close. So since they're close together, large proteins can't fit through the openings in between them. But smaller molecules like oxygen, glucose can pass through easily. So we see continuous capillaries in muscle, in your skin, in your lungs, in your central nervous system. Places where you want diffusion, oxygen, nervous system, lungs, skin, muscle, to get in quickly. Fenestrated capillaries have little holes or fenestration, so it means pores. They allow movement for little bigger things, small plasma proteins. So you're going to find these in areas of the body where there's a lot of fluid transport, and that fluid contains some important molecules. So very specific places in the intestines and the capillaries around that area to absorb nutrients from the intestines into the blood. And then also in the kidneys, they're going to be important for the filtering of blood to form urine. So intestines and kidneys are where we find fenestrated. The last type of capillary is called a sinusoid. Think of sinuses in your skull, big openings. Here's the holes or the sinusoids. So there are large gaps in between the cells. And so, of course, larger things can pass through these capillaries. So large formed elements, large proteins. So we're going to find these in the bone marrow, the spleen, and then some endocrine glands have some sinusoids, and even in the liver as well. So those are the 3 types of capillaries. Most common is continuous, that we have fenestrated small holes, and the big holes are the sinusoids. Where veins meet arteries, we have capillaries, and where they meet, this forms this meshwork of capillaries called a capillary bed. And all these capillaries in this bed have a similar function. They are fed by a branch of an arteriole called a meta-arteriole. And true capillaries are in that area, make up the bulk of the capillary bed. Okay, so I'm just going to the picture first here. So here is our capillary bed. We see the meta-arteriole right here. So it's feeding this capillary bed. And notice branching off the meta-arteriole, we have these little muscles right here. These are what are called precapillary sphincters. And a sphincter, just like we talked about in the muscular system, is a circular muscle that when constricted, it can cut off or prevent flow. And when relaxed, it allows flow. So what it does in the blood vessels, when it's relaxed, it permits blood flow into all the capillaries around it for optimal gas exchange. But when those sphincters are contracted, it can bypass all those extra capillaries to just go right to the veins. Pretty cool is it can control where the blood goes. It can be like a spout and open it to allow the blood to go into those capillary beds, or it can close the spout to just have the blood flow just through this one area instead of all of these. At any one time in your body right now, 1/4 or 1/4 of all the capillary beds are open. Perfusion, when we talk about tissue perfusion, it's the amount of blood that enters your capillaries per unit time per gram of tissue. Okay, so higher perfusion means more blood is getting into your capillaries, would be like this picture. A smaller perfusion rate would be like this picture. So now we're moving along our pathway. We're on to the venules. These are small veins that receive blood from the capillary beds. And they're receiving blood that is low in oxygen. And they merge to form veins. Veins, just like arteries, have different sizes. There's small and medium veins that receive blood from the venules. And then the largest veins travel right along elastic arteries back up towards the heart. And most veins, the bigger veins, have valves to prevent pooling in the limbs. You don't want blood to go the wrong direction. You needed to look up information on varicose veins. That's exactly what happens in varicose veins, where the valves in the veins don't do their job as they should, so blood starts to pool in them, making the veins puffy. And like you can poke them. It's kind of fun, but kind of hurts also. And the valves help get the blood back to the heart. So here is, again, our pulmonary circulation from the heart into the lungs and back. And here's our systemic to the rest of the body and back to the heart. Veins hold a lot of blood. When we take blood draws, we get it from the veins because it's low in pressure. Also, because the veins, there's a lot of blood within them at any one point in time. For that reason, veins are known as blood reservoirs, or holding places for large amounts of blood in your body. At rest, 70% of your blood in your body is in the parts of your body in systemic circulation. 55% of that 70 is within the veins of your body. 10% is in your arteries and 5% in your capillaries. The heart has 12% of blood, and then the other percentage is in between your lungs and your heart. So these systemic veins, 55% of your blood right now is in the systemic veins, or veins in the other part of your body besides your lungs. They serve as blood reservoirs. And in times of need, blood can be moved quickly from those veins, those systemic veins, into circulation. When they start to constrict, it will start to push blood back up towards the heart. So when you're exerting yourself, you need more blood. So the tissues in your body. So the veins will help push that blood back to the heart by constricting to get the blood being pumped out of your heart. They can relax as well. So the opposite, dilate, allow more blood to pool in the veins when you're resting, when you're sleeping. This is just a nice picture that is in your textbook, and it shows just the different arteries, if you want to review that. And then the different capillaries, the 3 types, and then the different types of veins. There are different pathways that connect blood vessels. It can be a simple pathway,